afternoon and welcome to another edition of WGEL's Public Affairs. I'm Ryan Mifflin. The COVID-19 vaccine and its availability in Bond County are the topics on today's program. Jeff Lydell now talks with Dr. Ryan Jennings, Chief Medical Officer at HSHS Holy Family Hospital, and Dr. Tom Dawdy, President of the Bond County Board of Health.
This is Jeff Lydell. Today we're talking about COVID-19 vaccine, and the guests are Dr. Ryan Jennings, Chief Medical Officer at HSHS Holy Family Hospital, and Dr. Tom Dawdy, who is the President of the Bond County Health Department Board. Doctors, the COVID-19 vaccine is the big topic right now, and it's been a long time coming, hasn't it?
Just glad we got light at the end of the tunnel.
I was just going to say it sure has been a while, and I absolutely agree with Dr. Jennings that we believe this is the light at the end of the tunnel, and this is the route that's going to be able to get us through this thing and substantially put it behind us.
Well, we talk about it being a long time, but in the medical world, developing a vaccine this quickly is really remarkable.
Oh, that is absolutely the truth. To think that, this unfortunate circumstance really didn't even arrive into the U.S. till, 10 months or so ago. And normally this type of a breakthrough in medicine would take years and even sometimes a decade or more. And yet because of maybe some prior work that had been done on other viruses, but also, the attention and the focus that the government put on this and the medical field, certainly experts in the pharmaceutical industry, really have accomplished something that has every opportunity to be a tremendous success and a great product in the end. The efficacy of the vaccines that are coming or that have come to the market so far are tremendously effective. So not only timely and rapid in their development, but incredibly effective.
Of course, the public thinks two different ways at least, and that's being effective and whether or not they're safe. And I know each of you doctors have opinions on that, probably the same opinion, but I'll ask each one of you, are the vaccines safe, Dr. Jennings?
They absolutely are, and actually as we've rolled out this initial doses of both the two vaccines that are out there so far, even in our internal experience of having given upwards of 7,000 to 8,000 vaccines across the health system, absolutely minimal reactions. The typical things that you would expect from a vaccine, a sore arm. There are some folks that maybe run a little bit of a low-grade fever, but nothing that, you can't manage with just some ibuprofen or Tylenol, those types of things. We've been very fortunate to really see minimal reactions so far. So remarkably safe, and again, with 95+% efficacy after the second dose, should be exactly that, the light at the end of the tunnel we've been looking for.
Dr. Dawdy, you want to address that matter?
Well, I certainly agree with that. I think, do keep in mind, even though this vaccine was developed very quickly, there's still been considerable experience with it already from the two companies that have vaccines on the market, tens of thousands of people who have taken the vaccine, and the serious side effect profile has been very low. We do have to just keep in mind and face the reality in our country that vaccine really appears to be very safe. Keep in mind that even though it's been developed rapidly, already tens of thousands of people, even the clinical trials, in addition to those that have received the vaccine while they've been on the market, have really done quite well with the vaccine. The incidence of any major side effects appears to be quite low. The side effects of the sore arm and the headache and things like that do exist for some people, but frankly, that's even panned out to be far fewer than what we originally expected. And I think it's helpful to keep all of this in some perspective. Already in the state of Illinois, 1.3 out of every 1,000 people in the state of Illinois has already died from this virus. That is a very sobering statistic. The risks of the vaccine are nothing compared to the risks of a COVID infection.
Tom, if somebody has had COVID-19, should they still get the vaccine?
Yes, they should. The current advice from the CDC is to go ahead and take the vaccine even if you've had it. You should not take the vaccine while you are still in that 10-day isolation time of being ill. And it's also advised that you not take the vaccine if you are currently quarantined. Beyond that, if you've had the disease, you're still eligible to take the vaccine. I will add that it appears that it is quite unlikely that very many COVID infections reoccur within the first 90 days after being infected with COVID. So Some experts are saying it's okay to hold off during that 90-day period to take the vaccine. I understand that it will allow some people to get the vaccine earlier. However, if you wait 90 days to take the vaccine and you're eligible for it now, you're also going to push some people who would be eligible in 90 days further down the road. So to answer your question, yes, you are advised to take the vaccine even if you've had the infection.
Now, we got the two different versions, the Moderna and the Pfizer. There's questions as to which one's better. I think you've both addressed that a little bit. There's a difference in how the doses are administered between the two companies' vaccine. Let's talk about if there's a difference in the two and if we have them both here or not. Dr. Jennings.
So the biggest difference between the two vaccines really is in the timing between the first and the second dose. So the Pfizer vaccine requires 21 days between the first and second dose, and the Moderna vaccine requires 28 days between the first and second dose. Those timings are important because in the studies, that's where they demonstrated the maximum benefit and the highest levels of immunity that typically reaches its maximum potential 10 days-ish, more or less, after the second dose. So it's very important that you are available to make sure that you can get that second dose. In that regard, the two vaccines are not interchangeable, so you cannot receive the Pfizer vaccine the first dose and the Moderna vaccine the second dose, which, depending upon availability of vaccine at any given time, that may determine then what will happen as far as your second dose. The way they've made the distributions is to ensure that when you have availability of, let's say, the Moderna vaccine now, we know we should have availability of Moderna vaccine in 28 days so that we won't have a lapse, basically, in that coverage. We have had access to both vaccines at various times, and as availability and production changes, that will be, that'll be modified, basically based upon what the supply is. But one of the key elements then will be making sure that the follow-up appointment for the second dose is essentially made at the time of the first administration, which also you need to be available. So if you're planning on not being available in 28 days or 21 days, depending on which vaccine, you need to give some consideration to the timing.
So are we in a situation where we have vaccine that is sitting on the shelf right now or in the coolers or wherever we have them in Bond County, or are we sitting and waiting for things to come in?
In Bond County right now, we're expecting to receive some doses this week. I think we have a few doses of the Moderna vaccine that is still present, that's scheduled to be given through the health department. We received 200 doses of the Moderna vaccine a couple of weeks ago, and half of that vaccine was held by the county for healthcare providers in the community. The other half of the vaccine went to the hospital for vaccination of healthcare providers within the HSHS Holy Family Hospital environment. I believe, and I'm not sure on this, Dr. Jennings may know on this, I believe those 100 doses have substantially been given, and the same for the health department doses. We do expect another shipment of the Moderna vaccine this week.
That is correct. Those doses have been administered, and the collaboration with the health department to get the colleagues and the frontline providers vaccinated first is critical for us to be able to continue to take care of folks when, unfortunately, we still have folks that become ill.
We've yet to receive any Pfizer vaccine?
We have not received any Pfizer vaccine through the health department at this time. Currently, because of the temperature requirements for the Pfizer vaccine requiring very cold temperatures in the range of 70 to 80 degrees below 0 centigrade, the Pfizer vaccine is tending to be shipped to larger areas, larger hospitals who have cold storage capabilities and can hold that vaccine safely. The Moderna vaccine at the present time is tending to be shipped into more rural areas that may not have that cold storage capability. And that's just where things are right now. That may change as cold storage capability increases.
Once people get the vaccine, do they need to wear a mask, Dr. Jennings?
Oh, boy, would I like to tell you that you don't have to wear a mask anymore. Unfortunately, that's not the case. Although we mentioned the fact that the vaccines are highly effective, there still is a 10% or so, 5% of the population with either vaccine having received it that will not be immune. And obviously it's going to take quite some time until we have a large percentage of the population that has been vaccinated. So during that time, there'll still be ongoing community spread and susceptibility to the virus. So for the foreseeable future, unfortunately, I still believe we'll be masking, and maybe by Christmas we'll all be able to unwrap our masks.
I agree with that. It's going to be a while that we still need to mask and take the precautions for social distancing as we have in the past. The other thing is that with both of the vaccines, while it's quite clear that they are effective in preventing symptomatic infections, it is not entirely clear if there might still be low-grade infections of COVID that occur, and people could still be infectious even though they've had the vaccine and even though they're not sick. We don't know for sure that people who've had the vaccine still cannot carry the vaccine and infect someone else. And that's a factor in continuing the mask wearing and the social distancing as well. That data will be available further down the road, but it just isn't there now, particularly in the time span that we're dealing with.
And I would assume, like other vaccines, you're not covered just exactly after they put the vaccine in you. There's time that needs to develop for that to get through the system and activate it.
That is correct, and again, that's part of why it's critical to have the 2 doses. So you get both doses, and then there's some very specific data on timing, but basically about 10 days after that second dose, most folks should have protective immunity, but there's also folks that don't respond with the fully active immune system. So we're going to learn a lot more as larger population becomes vaccinated as far as exactly what we're going to see for timing of full immunity.
As Dr. Jennings mentioned, there is some data about when that immunity appears to develop. Some folks may have questions. You may have heard that in the United Kingdom, they're looking at a plan right now of giving only the first dose of vaccine and not giving the second dose until quite a bit further down the road. The data on the 2 vaccines that are available in the U.S. right now indicate at that 10 to 14-day period perhaps about a 50% immunity. And it's not known how long that lasts and how effective that immunity is going to be. So the 2-dose regimen at this point seems to be very, very important. And it would be that 10 to 14 days after that second dose when hopefully the maximal protection with the vaccine is attained.
Dr. Jennings, what do you say to people that have it in their mind they do not want to get the vaccine with the COVID situation we're facing still?
I think the most important message around that is really the idea that even if you don't personally have concern about your own well-being, thinking that, I'm young, I'm healthy, if I get COVID, I'll be fine. It's the transmission of the disease to others that, it's a question of doing something not only for yourself, but doing it for those around you, those parents, those grandparents, healthcare workers that, are exposed to this day after day. It's critically important in order to get ahead of this thing that we do have people vaccinate. And so I really encourage the population to proceed, even if you're not worried about it yourself. This is a critical issue to protect those around you, those that you care about, and our community.
Okay, Dr. Dawdy, I know that the general public is thinking, when is the vaccine going to be available to me? So that's a big question, number one. Does the county have a plan in place to administer the vaccine, whether it be through the health department or Holy Family or personal physicians? And is there a priority list? I know that's a lot of different things, but there are things that we need to address.
Let me start with the priority list. The priority list that's been set up by the CDC and further refined by the state of Illinois puts people into priority groups. The 1A group, which we're vaccinating right now, are the healthcare workers, not just medical healthcare workers, but also think in terms of dental offices, optometry offices, podiatry offices, any kind of healthcare provider that's having face-to-face contact frequently with people. The school nurses, for instance, are also in the 1A group. The other portion of the 1A group are the long-term care facilities, and the vaccination is currently started in those facilities. That's under a little different contract. Almost all of the long-term care facilities in the state of Illinois have contracted with either CVS pharmacies or Walgreens pharmacies. Those large pharmacies will go into the long-term care facilities and vaccinate staff and residents at the same time. So that's separate from the other vaccination program that will be carried out in the county. In the 1B group, we move into frontline essential workers. That will include people like teachers, law enforcement officers. I forgot to mention that EMS are in the 1A group. But teachers, law enforcement officers, many people, again, who have a lot of face-to-face contact with people in the workforce. Group 1B had been for frontline essential workers and for people age 75 or over. Yesterday, the governor and IDPH announced a change in Group 1B that all people age 65 and over move up from Group 1C into 1B. Everybody over age 65 and over is now in Group 1B in the vaccination priority, along with frontline essential workers. Moving down into the 1C group is other essential workers who may not have as much face-to-face contact and younger people who have certain health conditions that may put them at greater risk. I want to emphasize that those groups are being further defined, and I fully expect to see some changes in those groups again within the next few days. But that's where we are right now with the groups. For the vaccination plan in the county, there may be other vaccinators who will sign up to administer the vaccine. At the present time, the county health department will be starting that. And registration for that, for people that are in those 1B and 1C groups, and then Group 2, which is the younger people further down the road, that registration, the state is in contact with an online company to allow that registration process to begin online to get the early part of it done before an individual would have an appointment at the health department to actually receive the vaccine. We will also have an option for people who do not feel comfortable or do not have online registration capability or don't have the tools to do that or may not be comfortable with registering online. We'll have a system set up so that they can register in another fashion. But that's how people are going to access this. The time when people can access will be publicly announced. It depends a great deal on how much vaccine is available at a given time, and frankly also with the manpower to administer the vaccine. We're talking about healthcare groups that are already stretched to the nth degree in taking care of the usual medical problems that exist all the time, the extra medical problems associated with COVID, and now we're piling a mass vaccination program on top of that. So simply having the healthcare people to administer the vaccine also means that it needs to be stretched out a little bit. Appointments will be scheduled. I would just tell people at this time to watch the news for when their group becomes available, and instructions on how to sign up will be provided. Right now, I would say it probably isn't going to add much to call the health department and ask, when can I get my vaccine? Because we simply don't know when the availability to the vaccine for different groups is going to happen. At the present time, the state would like to see everyone in that 1A group taken care of with the existing supplies of vaccine before we move into the 1B group.
Later in the week, after this interview was recorded, I talked again with Dr. Dawdy after learning people were calling the health department about registration. He told me we're not encouraging or discouraging the general population from calling into the health department. If they call, their names will be taken, and when they're eligible to register, they will be notified so they can go online to register for an appointment. That might occur in phases, and it will also depend on how much vaccine is available. When Group 1B opens up for registration, it will be publicized through the news media.
Now, for everybody, is it at no cost, Tom?
That's correct. There will be no charge for the vaccine. I don't know if some places may accept an insurance to assist with administrative costs of the vaccine or not, but there will be no charge for the vaccine itself.
So what you're saying is there might be a charge to administer it to you?
Yes, and I must say I don't know the absolute definitive answer on that, whether that would happen at our local health department or not. I will say I don't think so. I don't think there will be any charge for it at all unless someone wants to, if they have insurance that would cover the charge, I'm sure we would accept that. But we certainly would not require that. Nobody is going to be turned away from getting the vaccine because they don't have any resources to pay for it. That will not happen.
All right, Dr. Jennings, let me throw these three things that you've been asked. Will the vaccine alter my DNA, my fertility, and are there microchips in the vaccine?
Like any new thing to hit the market, there's always some myths that start to pop up and some things that people rightly become concerned about. And, with this being a new technology, this idea of an RNA vaccine being a relatively new technology, there's concern that it's possible that it could then somehow alter an individual's DNA. In reality, the mRNA doesn't enter the nucleus of the cell, so there's no possibility of anything happening to your own cells. And of course, that gets to the question around what could happen to a pregnant woman that was carrying a fetus at the time of vaccination. Similarly, there is no way that this type of vaccine would have any alterable effect on a pregnant woman or their child or anyone for that matter. In fact, most recently, the American College of Obstetrics and Gynecology have come forward with position statements specifically recommending that pregnant and breastfeeding women go ahead and receive the vaccine due to the fact that the severity of the illness in those populations tends to be worse even than the general population. And so the theoretical tiny risk of receiving the vaccine is by far outweighed by the benefit of avoiding the natural disease itself. So really great questions. The microchip piece, I think, is called a cell phone. So no, there's no microchip in the vaccine. I think everybody that is carrying around a cell phone already has a tracking device with them, so I don't think we need to be worried about the actual vaccination in that regard. There also were questions about fertility impact specifically, and there is no impact on fertility either. So remarkably, again, very safe vaccine. In fact, some of the original work around this type of vaccine started during the Zika outbreak, so any pregnant women may recall the angst around the Zika virus, and this technology was actually developed when that was in a high pace. Fortunately, that seems to have settled down before it really rolled out with any vaccination, but that was exactly why this particular type of vaccine was being explored, was to make sure that it could not impact genetic makeup and fertility.
All right. Well, we've talked about a lot of different things. I want to give both of you an opportunity to kind of wrap things up, what you guys think need to be emphasized at this time concerning COVID-19 and the vaccine. First, Dr. Jennings.
I think the important thing is just recognizing that the vaccine is safe, and as soon as it's available for you to get it, to please do so. Do that to protect yourself, but do that to protect others as well, as this truly seems to be that opportunity that's going to offer that light at the end of the tunnel, and that no matter after that, we still will need to continue to mask, to socially distance, and long before coronavirus came around, hand washing has been a good idea for, I think, since time began. So focusing on hand washing is always critically important, and I look forward to seeing tremendous results from this vaccine and tremendous impact on our public health.
Okay, Dr. Dawdy.
I would like to just add a bit on taking the vaccine when your group, whatever your group is eligible to take it. I think that's a fairly important issue. There are folks now who may be eligible for the vaccine who I think are perhaps taking a, well, I'll wait and see attitude toward the vaccine. And most of us as medical providers kind of think that way a good part of the time. When a new drug comes out, many of us don't want to be the first one to prescribe that drug, nor do we want to be the last one to prescribe that drug. We like to see how things work a little while before we start prescribing it for our patients. I think the vaccine's a little bit different. This is such a critical situation and such an overwhelming pandemic for the whole world. I think getting this vaccine into our population as quickly as we can and efficiently as we can is quite important. One of the concerns I have is that if people in a high priority group for the vaccine, just as somebody in the 1A category, chooses to wait and see, and then they decide 2 or 3 months down the road, I think I'm going to go ahead and take that vaccine. Effectively, what that does is pushes those other groups that have become eligible for the vaccine down the road. It pushes them further down the road. And I think there's a little bit of an potential ethical issue for that. I would just really encourage, if you're in a group that's eligible for the vaccine and you think you're going to take it, you think you want to take it, I urge those folks to go ahead and take the vaccine when it becomes eligible. If you put it off and wait, you will be bumping somebody out of line further down the road. I'd like everybody in those priority groups to jump onto the vaccine and take it as quickly as they can.
Tom, the way you look at it, once vaccine becomes readily available, it's not going to be a situation where, hey, we got it, if you want it, show up. You look at it as being an appointment type of thing to receive it?
There are a few places in Florida that have tried that, and it did not turn out well at all. You don't want to have a group of people who are wanting to be vaccinated with COVID. You don't want them lining up in a parking lot or in a building close to each other and potentially exposing each other at the time that the vaccine is going to be given. And it takes a little while. The consent process takes a little bit longer with this vaccine because it's a vaccine that is available to us through an emergency use authorization. And it's necessarily to go through the explanation of that with each individual. And with this vaccine, because of the very rare but still existent severe reactions that have occurred in very, very few people, but they have occurred, the recommendation is for people to wait in an area after they receive the vaccine for 15 to 30 minutes. So in administering the vaccine, you also have to be sure you have space for people to wait in the facility after they have received the vaccine. So we can't just safely pack in a full house, have people line up at the front door and come on in and get the vaccine. We don't have a safe space to do that, and I think very few organizations would have that kind of space. Yeah, I do expect it to be appointment-based.
I want to thank you, doctors, for being on the program today. I'm Jeff Lydell, and I've been talking with Dr. Ryan Jennings, Chief Medical Officer at Holy Family Hospital in Greenville, and Dr. Tom Dawdy, President of the Bond County Health Department. Our topic has been the COVID-19 vaccine for Bond County.